In the last 10 years, more and more research has started to look into the potential of tDCS. In particular, research to back up the claim that it could be used to treat major depressive disorder. So what is tDCS? Well, transcranial direct current stimulation, or tDCS, is a neuromodulatory technique that uses low-intensity direct current to cortical areas of the brain. The tDCS hardware consists of two electrodes called the anode and the cathode that are placed on the head to deliver the current into the brain. The idea is that the anode will excite the area below it, while the cathode will inhibit the neural activity in the area in which it is applied to. The location that the electrodes are placed will depend on what particular function or area of the brain you're trying to target. The tDCS only uses a small electrical current of around 0.5 to 2.0 milliamps. The current is so small that it's not painful, and most people only seem to feel a mild tingling sensation on their scalp. A tDCS session typically lasts around 20 to 30 minutes, and patients usually complete a number of sessions over the course of a few weeks. tDCS is also different from the electric shocks used in electroconvulsive therapy, which is sometimes used to treat extremely severe depression. In contrast to electroconvulsive therapy, tDCS is considered to be a non-invasive therapeutic treatment and uses a much smaller amplitude. While there may be many beneficial results that tDCS claims to achieve, such as boosting your memory and focus, treat depression, or help you sleep better, studies have shown that tDCS might help with some of these things, but there is still a large amount of controversy that surrounds the device. Researchers aren't clear on what tDCS does to the brain on a physiological level, and as a result, there is quite a lot of debate between researchers and the results. We do know that electric currents can affect the way neurons fire. Current research hypothesizes that the applied current from the electrode changes the membrane potentials of electrons, allowing them to fire more easily. The theory that supports tDCS explains that with enough stimulation and repeated exposure, the neurons receiving stimulation will start to fire more. As a result, over time, the stimulated neurons could help damaged or underperforming brain areas function more and in a healthier way. While tDCS seems to have a lot of potential, the following are some of the issues that have been raised against it. According to a study conducted in 2016, scientists used a cadaver to measure how much of the applied current from the tDCS managed to travel through the skull to the brain. Results showed that most of the current was redirected by the skin. The electrodes that were placed on the inside of the skull showed that only around 90% of the electricity applied through the tDCS actually made it inside the skull. While some of the studies done with tDCS may have positive results, they are studies that are mostly conducted in clinical settings, which could have a strong impact on the results when performed at home using a bought tDCS device and treating yourself at home. If the electrodes are not properly aligned in the correct location, unwanted or incorrect stimulation could occur. Therefore, the translation to a home treatment device is still quite low. Researchers are also looking into tDCS as an alternative treatment for depression. A meta-analysis from 6 randomized control trials with 289 participants in all showed that tDCS relieved symptoms of depression, even in people that felt no benefits from medication. Several meta-analyses supported the antidepressant effects of active tDCS and also found them to be significant against the placebo. Future research should look into remotely supervised tDCS as a way to improve guidelines and protocol to further the amount of research into tDCS, as well as improving the clinical setting to home transition. Furthermore, developing parameters of use for a computer-based human brain to further the investigation of electric current fields and magnitude induced by tDCS. Overall, tDCS looks to be a very useful therapeutic tool in the future. Current studies show a lot of potential, and by performing further studies, could provide solid evidence for a very useful treatment for major depressive disorder.